Good morning, everyone. This time I am uploading one more video about how to become a GP in UK. Um, as we know, GP is basically general practitioners, and the model of the healthcare system in many countries, including the UK, Ireland, Australia, Canada, is basically GP based healthcare system in which the general practitioners they work in the community and they are the one who deal and treat the acute and chronic illnesses, provide preventive care and also health education to the in the community, and they are the one who basically act as a bridge between the patients and between different specialities and also the tertiary care system. So and that's why there is a lot of need of GPs in these countries, and there are training programs also. One of the best in the world is GP training program in the UK. Also there is GP training program in Australia, Canada and Ireland also. So general practitioner or GP, it's a common term basically which is used in the UK, in Ireland, Australia, Canada, all these countries, and it's a very competitive type of specialty. And there are many pros and cons of becoming a GP. I would say like there are more advantages than disadvantages, and the biggest advantage is that it's a 3 years training program in the UK. I will make one more video about the GP training program in the Ireland as well. And once you will be in the training program and you will complete the training and clear all the requirements which are required by the Royal College of General Practitioner, you will you can work as a general practitioner not just in the UK but also in Ireland, Canada, or Australia, or any other countries where you like to work. Like in many of the like general practitioner and family medicine, they are very close to each other. You can say like they are the same name, different names for the same thing. And in many countries like India, Pakistan, Bangladesh, many doctors they work as general practitioner without any formal training, though there are programs nowadays running in these countries as well for family medicine, in which like people can do residency and they can be trained. Whereas in first world countries, there is like training programs which you can complete and you can work as a general practitioner, as a registered general practitioner. So now to start with, um, this one is GPST or GP specialty training. So in UK, basically there is it's a 3 years program, in which you are going to spend 18 months in the hospital setup. Most of the time, it varies sometimes. So, and this is basically if you are doing a full-time training, because if you are getting into the training program in the UK, so it's a very flexible type of program in which you can go for a full time, which will be completed in 3 years, and then you can opt in. For example, if someone who cannot work full time, so they can reduce the working hours every week, but in that case the program is not going to finish in 3 years, but it can take like up to 4 years, 5 years, 6 years, like that. But that's a different thing. Maybe we will talk about that in a different what you can say video. In this one, I'm going to take you very simple, and I will let you know how you can enter into JP training and you can be a qualified GP in the UK. So this 3-year program, basically you will spend 18 months in hospital setup and then 18 months in the um, general practice. So basically you'll be working in some practice, clinical practice with some GPs for the last 18 months. And the 18 months in the hospital, basically they will put you in 6 months rotations most of the times, or sometimes 4 months rotation. So usually they put you in general medicine, in psychiatry, in gynae obs, in pediatrics, things like this. And once you will complete those rotations, which could be 4 months of rotations or which could be three rotations of 6 months, then you will start working in the GP practice for the next 18 months. And on joining the GP specialty training program, you should register with the Royal College of General Practitioners, and you have to clear some exams as well. Um, we will talk about that thing in a while. So the most important thing which comes into people's mind is how many posts are available. So if I will talk about UK, basically they every year they run two recruitment rounds. So round one each year, basically they like the jobs, or you can say the training starts in August. For example, right now 2023 round one is running. So people who will be selected in this round, they are going to start their rotations from August 2023. And then there is 2023 round 2, which is going to start next year somewhere around June July. And the people who will be successful in that, they are going to start their training in 2024 February. So there are two rounds each year. um, so basically round one is the main round, and round two is for all the leftover seats, because many of the doctors they choose different or what you can say fields like psychiatry, emergency medicine, so they just leave their program and they choose the other ones. Now, to tell you about more about this one, how many posts are available? Yes, so in round one there is a lot of posts. It is in thousands because UK is a very big country, a lot of population, a lot of posts, a lot of trusts are there. So there is a lot of seats available in round one. It is in thousands, like you can say a couple of thousands or more than that, 3 4 thousand sometimes. But they keep on changing. And round two is for the leftover seats. So it completely depend how many people they have, or candidates or doctors they have not taken the post. So but it will be again around 4 5 600 of seats, every year, which are available in round two. So if I will compare like UK with Ireland, for example, UK have a lot of posts available, and many doctors they sit for the exam and they do get their post somewhere in the UK. And that completely depends on the merit and on your preferences. We are going to talk about it soon. So, talking about okay, so now talking about what you can say How we go for that is basically, okay. So now let's talk about the hospital posts. um, as I told you, like they can put you in general medicine, elderly care medicine, pediatrics, community pediatrics, obs and gynae, psychiatry, ENT, A&E, dermatology, ophthalmology. So basically, there is a lot of things, but most of the time they put in general medicine, pediatrics, and obs and gynae, and psychiatry, and A&E. So these are the posts. Basically, either it could be 6 months, or either it could be 4 months. Once you are going to what you can say complete this one, your post, and then they will put you in the general practice for the next 18 months. Okay, so when you are going to complete these all 3 years training program, so basically you will get a certificate of completion of training, CCT. It is called a CCT, certificate of completion of the training. And during all your placements, you will complete workplace based assessments, WPBA. So these are basically competences. They will sign all the things with procedures and stuff you will do. So that is workplace based assessments. And during that time, basically, you have to prepare for your MRCGP examinations as well, which have two parts: the Applied Knowledge Test (AKT) and the Recorded Consultation Assessment (RCA). We will talk about this exams in a separate video. And also, like while you are in your training program, your progress will be monitored at least yearly by an annual review of competency progress panel, that is called as ARCP panel. And usually basically educational advisor is assigned to you, who discuss with you your what you can say, your progress and your difficulties which you're facing during once you're in the program. Okay, so how we apply for this one is, you have to basically sit in an exam that is called as MSRA. And what is this MSRA? It's a assessment exam, very, you can say, easy type of exam. And what I will do is, I am going to make a separate video, a detailed video about MSRA, that is multi-speciality recruitment assessment. Okay, so soon I'm going to make a video about this exam, and I will tell you what this exam is about and how you can prepare for that, and all the details we will talk about this exam. But uh, short, like simply, this exam is not so hard, and it is basically done online at Pearson. So you have to do this exam, and they include the score of this exam in, you can say, the merit or in the process of recruitment. And depending on the score you will get on in this exam, if you will score very good, very high score, then you will get a place of your choice. For example, if you are your preference on the top, you are saying that, I want some specific hospital in London. If your exam, the score is very good, maybe you will get that. Or like, depending on who else score is more than you, and if he have preferred that hospital, so maybe like they will get. So you have to basically aim for a good score in this exam to get the place of your choice. So personal skills assessed in the recruitment and selection process. They basically check your clinical knowledge and expertise, empathy and sensitivity. Um, they check your communication skills. They check your conceptual thinking and problem solving, coping with pressure, organization and planning, and managing others and team involvement. So all these things basically before they used to uh, first of all take the exam, which is MSRA, and then they conduct interviews, and in interviews they ask different questions, and then they used to make a merit. But nowadays, after COVID, um, no interviews have been taken, and still it's 2023, recruitment is going on, and still, all the selection is based on, is completely depends on your MSRS scoring. So how we can apply in this one? So before you are applying for GP specialty training, GPST, you must know that you should have some requirements. One of the requirement is basically GMC, General Medical Council registration. Remember, GMC or General Medical Council registration is not important to sit for this exam, but it is very important, or it's a mandatory requirement to start training in UK, because you cannot work in UK without having registration with GMC, General Medical Council. And how to get GMC registration? We know, like, there is an exam called as PLAB. You can get the registration through that, or there are some other pathways as well. We will talk in a separate video about that. So how we apply? Basically, we apply by Oriel account. So Oriel Oriel.nhs.uk is basically the website where you have to make an account and you have to upload the documents. And it's a very simple, very straightforward thing. The only document they want is that you must have 2 years clinical experience by the time you start your training, and that experience could be in any country, not just in the UK. Like, why they want this thing? Because in UK, all the doctors, they go for from foundation year 1, and then they do foundation year 2. So foundation year 1 and foundation year 2, you can say, like, for example, what we do in Pakistan is house job. So foundation year 1 and 2 is basically very junior level posts, and you can say, like, it's just in internship in the UK. So you must have 2 years experience before applying for this. And if you are not working in UK, but you're working in some other country, if you have internship with 1 year of experience after internship, then you can simply get a form which is called as the CREST form, signed by any consultant to whom you work with for at least 3 months. Okay, so CREST form is like, if you will Google it, CREST form, so you can find the CREST form and you can download that. It's simply competencies, like, the consultant is going to sign that you have all the uh, skills which are required to enter into a specialty program. For example, history taking, how you handle the patient, what you're about your communication skills, and things like this. So any consultant can sign to whom you work with for like at least 3 months, who have observed you for 3 months. And once you are going to upload that CREST form, um, which is basically, you can say, what CREST stands for. It is basically Certificate of Readiness to Enter Specialty Training. So it's just, you can say, a checkbox type of form in which they will checkbox, like, either you are competent enough, like your behavior, your patient care, your trust, your ethics, um, like all these things, your leadership qualities. They are going to uh, check check those boxes, and that's it. That is what is required. So you will simply get this CREST form signed, and you will upload it on Oriel system, Oriel website. English evidence is needed, especially for those who haven't worked in English countries, or if someone have, for example, General Medical Council registration, so that's your English evidence anyways. So only these two things are needed at the time of application, but like definitely before starting your training, you should have the right of to work in the UK. That's basically a visa. If you are not from any European country, or if you're not a UK national, then but like don't worry about this one, because once you will be selected, so they are the one, or your trust is the one who is going to send you all the documents to apply for the visa. And health and police clearance, definitely before starting your job you have to get a police clearance from here in the UK, and your health screening will be done. So this one is definitely not needed to apply, but they are definitely needed once you are going to start, before you will start your training over here. The only thing which is needed for that to sit in the exam is the CREST form, which I told you is a very simple form and any consultant can sign. This is the most important thing. So once you are going to upload your CREST form on Oriel account, the rest is very simple. In Oriel account, you will find that which round is running, either it's round one, round two. The dates will are displayed over there as well, and you are going to simply uh, click on that you are want to apply for the GP training program. And once you are going to do that, what they will do that they are going to send you a link or invitation to sit for MSRA, that is multi-speciality recruitment assessment exam. And then you are going to sit when you then you are going to attempt the MSRA exam online. And after that they are going to disclose your score after some days or some weeks, and then they will, according to the preferences you have provided on Oriel account, they are going to think like either, or what you can say, you are getting any position, or either you are getting the position, the place of your choice or not. So always like before applying for this one, make sure that you have primary qualification MBBS, you have GMC, full GMC, General Medical Council registration at the start of the date of your work over there. You must have a CREST form. Okay, and if you will get a GP training, I told you already that they are going to, like if you're not in the UK, if you're in some other country, they are going to provide you with the things to apply for the visa. And rest is all the things which you need basically later on, not for the exam. Yeah, one of the thing which they do ask is like preferably the doctor should hold a full license before starting their training. But if they don't have the license, basically they get a form signed from the doctor that you will arrange all the what you can say, your transport things yourself, because sometimes you have to travel from one place to other place in the, like, because the hospitals, they have different departments and at different places. So that's the reason for that. So as I told you, like nowadays, it completely depend on MSRA score, on which they decide which place you will get. No interviews are conducted these days, but I'm not sure like if they are going to start the interview soon or not. And I will make a different video about the Oriel account and about the preferences. So once like you will get an offer after the MSRA results will be out, and they will send you the offer like depending on the preferences you have selected. So either you can accept that offer, either you can reject the offer, either you can hold the offer for a few days, or either you can hold with upgrades. For example, if you have named a hospital in London on the top, and you are getting, for example, your sixth or seventh preference, which could be Bradford or Manchester Hospital. So if you will press hold with upgrade, so if any doctor will leave like the preferences which are on the top for you, so they will basically automatically upgrade to you, and they will keep on sending you emails that like this one. So that's all for that one. One thing is transferring recruitment score. Sometimes many of the candidates basically they don't get the offers of their choice for like because many people, they have different issues. Sometimes they want to someone want to stay at some specific place, for example some hospital in, again, London, and the family lives there and they don't want to go to any other place. So if they are not getting that that place in that particular round, so you can refuse all the offers, and basically you can transfer your scores which you have scored in the MSRA exam to the next round. So basically you can carry forward your scores for at least 1 year, okay, in like 1 year round. And after that, like if you don't get the offer even in that one, then you can again sit for the MSR exam. So that's all. That was a short video about this one. Soon I'm going to make a video about MSRA exam, and also I'm going to make one more video about the Oriel account. Okay. So if you have any questions, you can write down in comments, and I will try to reply them. Thank you.